Over the last 5 to 10 years, health has changed tremendously in the community. The emphasis is to look after people in their own home as opposed to secondary care, hospital care.
We have a growing population of people who are getting older and often have several conditions that need to be managed.
The problem is that the numbers of people with long-term conditions is increasing very rapidly, and numbers cost money.
The real pressure is to try and carry on delivering as good, if not better, service.
You can spend your life going in and out of hospital, and your career, if you like, becomes the career of a long-term condition patient.
I was diagnosed with a brain tumour in 1998 after I had an epileptic seizure. The tumour was treated with surgery and radiotherapy, and I was given medication for the seizures. Last year I had 2 epileptic seizures out of the blue. The doctors decided to put me on epilepsy medication again. It was very worrying to be diagnosed with epilepsy because I've got a young child, and I was mainly concerned about the possible impact on him. If I were to have a seizure, I would be unaware of my surroundings for at least an hour. So he would be left to fend for himself, which is obviously a great concern. My condition has had an impact on my child. I have to be free of seizures for 2 years before I can drive. That is obviously a big change to my lifestyle.
My mother was diagnosed with breast cancer and unfortunately had to have a course of quite severe treatment. Our biggest concerns and fears when first diagnosed was what was ahead of us. It was all very daunting, not knowing, but also how could we look after her? Did somebody need to be there? We didn't know the intensity of the treatment. Can we give her what she's asking for, which was to be able to recover in her own home?
We've been searching as an organisation for ways to deliver better healthcare more efficiently, making use of the technologies that are available, making use of innovative approaches.
Patients really do benefit from being in control of their conditions. It certainly reduces their anxiety.
It gives them the ability to look after themselves, to be much more involved in the decisions that are made around their care, helps the care that they're receiving to actually be the best care for them. They can just integrate the clinical care and support that they need with everyday life.
They're able to maximise their own independence really, and what they can do and where they can go.
So if you have really good kit that can help people monitor their health conditions, and you have really receptive and responsive health professionals who can support people to use that kit, and if they feel confident in their own ability and understanding of how to use that equipment, and they have people at the end of a phone line if things go wrong, in other words, a supportive enabling system, then that digital technology can be a really important factor in giving people confidence to manage their own conditions.
The idea of keeping people away from hospital via those sort of means, fantastic.
Played a very important part in us giving her independence and allowing her to be able to recover at home.
If I were to have a fit, someone would be on hand quickly to help my son so that he wouldn't have to be on his own. If I had a seizure, someone would be there to help, which is an enormous difference.